Good afternoon. My name's Jayant, and I'm the head of global oral health for Haleon. You might just wonder, what is an oral health guy doing in this forum? So I'll make my intent very clear right from the beginning. I'm here to press for the strong case for inclusion of oral health in the non-communicable diseases strategies, starting from the European Cardiovascular Disease Plan. Let me start with a simple question. How many of you, please raise your hand. You've already raised your hand. Thank you, even before the question. Thank you. How many of you brush your teeth regularly twice a day for 2 minutes? Just raise your hand, amuse me. Wonderful, thank you very much. Keep your hand raised if you've ever noticed some bleeding gums whilst you brush. Yeah, that's about 30% of the audience, and that's the incidence in global population as well. And one final time of raising your hand, if you've heard about or are aware of the linkages between gum disease and type 2 diabetes. There are quite a few people here who are aware of that. See, for most people, oral care is a daily habit. You brush your teeth, sometimes you floss, sometimes you mouthwash. But what if I told you, and some of you are aware, that poor oral hygiene or poor oral health is strongly linked to diabetes, to cardiovascular diseases, and to other diseases, falling within the range of top 10 global causes of death actually. And despite nearly half the world's population, which is close to about 3.5 billion people, affected by poor oral health, these diseases remain largely preventable. Simple acts of daily twice brushing with a good toothpaste can really help. So we need to move the discussion on oral health from the margins to the mainstream and bring it to the center as one of the key pillars of the NCD strategy. And the turning point, a really important point, is coming for us with the release of the European Cardiovascular Disease Plan. And that's what I'm here to press for. At Haleon, we do believe that oral health has a significant role to play to move from the margins to the mainstream of any NCD strategy. Because oral health isn't just about teeth, it's about your whole body. It is critical that we address the shared risk factors between oral diseases and other health conditions to drive a comprehensive and unified approach to NCD prevention and health promotion. As I said before, poor oral health hygiene is linked to diabetes, cardiovascular diseases, some respiratory conditions, and more. Research by the economist Impact, supported by Haleon, shows that by seeking professional gum care and maintaining good oral hygiene, nearly 57 million people across the globe could avoid developing type 2 diabetes, saving significant costs over the next decade. In fact, some estimates suggest that we could save close to 15 billion euros in Germany alone, and in Slovenia about 114 million euros over the next decade. That's why Haleon has joined forces with like-minded partners to ensure oral health is represented in the UN Political Declaration on NCDs. And we hope to see that reflected in the final declaration. A lot of progress has been made, and there was some good conversation in the morning and over the course of the day regarding healthcare access and innovation. But despite all this progress, only 23% of global population has access to oral health services. Furthermore, clinical care focuses too much on repair and not enough on prevention. WHO and dental professionals agree that twice daily brushing with a good quality fluoride toothpaste prevents plaque, gum disease, and tooth decay. Yet, globally, only 2/3 of the population do this regularly. And low health literacy makes it harder to navigate healthcare systems, follow treatments, and manage chronic conditions. It leads to worse health outcomes, more emergency appointments, and higher medication use. But even a 25% improvement in low health literacy can lead to savings of up to 0.5 points of GDP across some of the European countries. So we must recognize the importance of oral self-care and enhance oral health literacy through education campaigns, professional training, and integration into broader NCD strategies. Haleon sees significant opportunities for public-private partnerships in this regard. For example, earlier this year, to coincide with their presidency of the EU, Poland declared 2025 the year of prevention and health education. Working with the Polish Senate and the Council of Dentists and Doctors, we are convening a national oral health coalition and launching a pilot program to deliver oral health education to students, their parents, and to the teachers in primary schools. The oral health inequalities are indeed stark, especially among the low-income groups in Europe. These communities face limited access to dental care, fewer educational resources, and higher exposure to risk factors like tobacco or sugary diets. The result? More untreated cavities, more gum disease, and poorer overall health. As part of our ongoing commitment to tackle health inequalities, we launched the Health Inclusivity Index in partnership with Economist Impact. It's the world's first global benchmark index assessing government efforts to enable accessibility to good overall health. This study identifies where health inequalities exist and what can be done to address them. Data from this study provides insights into public health areas needing attention across several countries in Europe. And one of the most striking examples of this is oral health. Oral diseases are amongst the most common and preventable NCDs in the world. In fact, more prevalent than all the 5 other NCDs combined, which are mental disorders, cardiovascular diseases, diabetes, cancer care, and chronic respiratory diseases. Furthermore, the disease burden falls disproportionately on lower income and underserved communities. Because oral health is one of the clearest signals of deeper health inequalities, tackling this issue is a concrete and important step to reach those who are already facing the greatest inequities. So we have a real opportunity to put oral health on the map, both at the European level and within the national strategies for NCDs. And as I said before, one key moment is just around the corner, which is the release of the European Cardiovascular Disease Plan. As this plan takes shape, and as the EU rolls out its broader NCD agenda over the 2024 to 29 period, we believe there's a real opportunity to put oral health firmly on Europe's public agenda. This means integrating oral health into the EU's NCD response and strengthening early intervention and prevention efforts across member states. To our fellow panelists and policymakers in the room, let's commit to making oral health a key part of NCD strategy, starting from the European Cardiovascular Disease Plan, given the strong linkages that already exist between poor oral hygiene and some of these diseases. Together, we can move oral health from the margins to the mainstreams and build healthier, more resilient societies across Europe. Wouldn't that be something to smile about? Thank you very much.